starting, I would just like to give you a small introduction.
Yes.
Okay. So we all know as community physiotherapists, we all are not just enablers, but also advocates for an inclusive society. We'll be talking about importance of UDID, that is Unique Disability Card. So we all know that it's not just a card made up of plastic, but it is also something which symbolizes our commitment to fostering a society that embraces our diversity. So to guide us through, we are truly honored to have an distinguished expert in the very same field, Dr. Rahul Maid, sir. Sir is working at Kamla Nehru Hospital. He's basically responsible for all the disability board in charge, and he's working for the same. So I would like to request sir to please start with his session.
Thank you, ma'am. Thank you. Yes. So regarding UDID, yes, that is very much important thing, and what we are knowing about all the schemes related and the benefits for the disabled person. Okay, so for that purpose, the government of India is regularizing, and that is initiated a project, okay, that is under the UDID system. Okay, UDID, first thing is UDID means what? There is a unique disability identity card. Okay, so that is a holistic approach by taken under the Ministry of Empowerment of Persons with Disability and Social Justice and Empowerment of that ministry. Okay, so in this UDID card, why that is going to be in a means government is started the on a national level. Okay, so unique and all database should be on the online basis. Okay, online basis, and that is very much important to gain benefits or the scheme related or any scheme related to that particular person, disabled person. Okay, so he or she might be taking all benefits with the help of the government. Okay, so again, the what basically UDID is, it is having those who are having the disabled. Okay, and that all data you can get online. Okay, so again, this is important for the persons, those who are having the problem related to the mobility or related to the persons with physical impairment or mental impairment. So all that we have to, prior that we have to submit, or we have to just apply the online. So this is an UDID. Yes, I'm sharing the screen. You are looking this UDID disability ID, unique disability ID. Okay, on this website you can go for the apply online application for that particular person. Okay, in physiotherapy related, the more contact doctor is physiotherapist, because he is going to or she is going to treat a person with disabled. Okay, and sometimes what will happen, there is no any schemes, means some patients are that they are not knowing the what government is regularizing or what government is giving the schemes and benefits to the particular disabled person. So doctor or physiotherapist has the no he means he or she can give or take a benefit from the government of India or government of Maharashtra. So for that prior, so how we means this UDID is going to fill online form, and it is very much accessible for a medical board. Okay, it is quick assessment. Okay, and one more important thing, why they are giving a online database, because sometimes or previously prior this online database online database, there are some duplicate certification is going on, and they are misusing these benefits of the government of Maharashtra or government of the India. And after that, you can easily accessible those who are having the renewal of the disability certificate or disability card. Okay, what is the your renewal means? Those who are patients who are having the temporary certification. temporary certification. Temporary certification means what? There are two types of the disability certificate. One is permanent certificate and one is temporary certificate. So permanent means what? The person is not going to improve, okay, here further, so we can go for the permanent disability certification. And temporary means patient can progress or regress also, sometimes regress also. So there is a little bit validity that is depending upon the condition, whether it is valid for the 1 year, whether it is valid for the 2 years. According to that particular condition, we can give the renew means temporary certificate and the your permanent certificates. After that one, MIS reporting framework. Okay, you are seeing on the screen. MIS reporting means what? Means you can get all the data related in means overall in the nation or national level. Okay, MIS means what? There is a management information system. So that is very much important thing related to the students who is studying in the PG or who is studying in the UG, and those who are doing the research work. Okay, so in MIS reporting framework, you can get all data. Okay, related. Just I am showing this on the screen. This is what aggregated data, na? So this is all showing the online database overall the national level. Means here you are seeing CVS download and Andaman Nicobar. Just you have to write it here, Maharashtra. Okay, so you can see all the data. Okay, and that data is district wise. Yes, already sir told that the district level you can get, or that patient can get the certification. Okay, and only the government person or government hospital only that will give the certification, because there is a disability board and there is a chairperson. Okay, there are a team, those who are giving the certification, and prior that the assessment of that particular person, whether that person is undergoing for the temporary certification or the permanent certification, and overall the physical assessment, okay, according to that particular condition. So this is the MIS reporting. You can see this Maharashtra district name, whatever you want to put it in this search tab. Okay, so you can get all the data. So you can go for the prevalence studies. Okay, so all type of blindness, cerebral palsy, chronic neurological condition, and that is depending upon, means that is this data is related only district wise, so you can get and you can study in your district also. Okay, so after this is MIS report, that is very much important for the student, those who are doing the research. Okay, if and it is very much important that gives the effective management, including interoperability, that benefits and the schemes. Okay, by that is launched by the government of India. And this unique, and this card is going to show whether means that particular person is getting benefits from that particular schemes or not, whether he or she is eligible for other benefits. Okay, that is also going to show in online system. Okay, and after that again, so if the person is having take care of additional disability in future, means if suppose patient got again an accident, so he can get other more percentage of that particular disability and related to the benefits and the schemes. Okay, now, this is all about the UDID card, which is helpful for the patient or the disabled person. So now, if suppose you are having a patient and they are not knowing how to apply the for disability certification, so this is a unique disability ID website authorized by the Ministry of Social Justice and Empowerment under the Government of India. So this is the UDID, and see this tab on the registration. Okay, right side of the screen, register first. Whenever patient is having and they are not knowing, so first any person, those who are going to apply for the disability certification, whatever the assessment comes, first that person should apply and over this registration. Okay, seeing this, just I press the register. So now this all information of that particular patient, you have to fill this information, whatever that person concern. Okay, so in this application we need, yes, already sir told that we need certain documents, that if suppose patient is having previous disability certificate, that also that person should attach that disability certificate also in concern with that particular disability. Again, Aadhaar card, if suppose patient is having PAN card, and important thing, photo and the thumb impression. If thumb impression, sometimes patients are not, means patient is having the blindness or the disability related to the ophthalmology, and that time only the thumb impression, if suppose patient is able to sign, so that is signature. Okay, so these are the important document that you have to upload while filling the application. Okay, and identity proof. Okay, identity proof, this is all. Again, this column is disability related details. Okay, sometimes patients while filling, they are not knowing which kind of disabled I am. Okay, because there are different kinds of conditions. Okay, so in this, patient can tick any one of this, but after that, when that form is going to be scrutinized by the medical authority or the district medical board, okay, where that patient can go and draw the certificate. Okay, in on that basis, the doctor will decide which kind of the disabled person. Okay, here are some points, that is acid attack, autism, blindness, cerebral palsy, hearing impairment, hemophilia, locomotor disability. So basically, in concern with physiotherapy students, okay, so we are more concerned with the locomotor disability, leprosy disability, means for the assessment. Again, on medical board, there is a team chairperson is your district dean or medical superintendent. Then there are few chairpersons like HODs of the department, like orthopedic department, ophthalmology department, ENT department, and physiotherapist also. Okay, for the assessment of physical impairment. Okay, on depending on their assessment, they are going to scrutinize the percentage, and there are valid database and the document comparing the disability percentage. Okay, so this is all regarding, means the online application of the person that has to fill prior the certification application, for getting the certificate from the medical board, particularly in a district level. Okay, so after this is the in general application of the person. Okay, after registration of that particular person, that person should log in. Okay, this login, these are the credential that person will get by the message or by the mail. Okay, the UDID or the enrollment number, date of birth they have to put, and they have to write it the captcha and login. In that this login credential, you can get the all document uploading. Okay, so after completion of this form, yeah, that person should take the printout. Okay, printout of that particular form. And meanwhile, previously offline forms also eligible for the criteria, but the particular sanstha's or the what we can say, the welfare systems or the little bit, they are providing help to the disabled person, so they will apply that particular person's online application. Okay, after this application, so particularly they have to select a district where they stay or where they want a disability certificate. So in that form is going to show the in the departmental login. Okay, this is the departmental user login. Okay, so this departmental user login means what? There is a authorized medical unit or medical board. Okay, medical board, that medical board is if suppose I am concerned with the PMC, Pune Municipal Corporation. So in Pune city, there are 3 to 4 hospitals. They are going to provide disability certificate. So they are having their own user login, because in that user login there is a what we can say, the team. Okay, chairperson, 3 medical officers related to that particular condition, physiotherapists, so the all data of that particular doctors. Okay, because on that certification their signature and their registration number is going to be applied for that particular on that board. Okay, and that is very much important. Okay, for the certification, because on that person should be appointed by the government of Maharashtra or government of the India. Okay, so after this online application, the departmental user login should see that form whether there is any corrections are there. So corrections means mainly the person are by mistake, they are doing the mistake in the date of birth, address, mobile number. Okay, because they are going to again face the problem in related to this schemes, like if they want to concession in the train ticket. Okay, or the concession in the some education. Okay, so in such problem they will get. So priorly we have to scrutinize a form of that particular disabled person. Okay, so then only we can proceed assessment and we can verify. And in that departmental login we have to check all the documents, okay, related to their previous, if suppose they are eligible for previous certificate, that also. Again, the Aadhaar card, PAN card, address, okay, mobile number. Just I told you that all the things we have to check, cross check, and we have to verify that. Okay, after verification, okay, but we can just I'm showing you yes. So this type of username and password will come. So that is again more responsible that particular unit, medical unit. Okay, after the application, after the verification of that particular patient's form, we need to send them to the assessment system. Okay, assessment system means what? Particular doctor, authorized doctor. If suppose patient is coming for the ophthalmology, okay, so we have to send them for the scrutiny of by the physical assessment of the ophthalm. Okay, ophthalmologist or the ophthalm surgeon. Okay, if suppose patient is physically impairment, like if suppose the patient is having amputation, so prior what kind of amputation is that, so we have to need to send them to the physiotherapist. So that physiotherapist will assess all the physical impairment and they will give the percentage, means what are the patient is having strength and the weaknesses. Okay, so according to that the percentage will happen, and that assessment is directly gone to the orthopedic surgeon. So again orthopedic surgeon will assess and compare both the data are same or not, and they will proceed for the further. So after verification of that document assessment, we need to assign a specialist doctor. Okay, the third process is assign the specialist doctor, means on that assessment scrutiny there is a doctor's name and whatever his or her specialty. Okay, a specialty person only give the percentage data, percentage to that particular disabled person, and that again with the sign and the stamp. Okay, so that stamp or that assessment sheet is going to be scanned. Okay, scan. After that scanning process, we need to upload that document over the login. Okay, in that particular patient's data, means in departmental login. After uploading, we need to, there is a medical board. After this uploading, we need to go for the next procedure, that is medical board. So in medical board, there is I told you that a chairperson and three medical officers. One is apart from that particular condition. If suppose we are giving the physical impairment, means apart from the orthopedic surgeon and medicine, orthopedic surgeon and chairperson, there is another doctor related to the ophthalmologist or related to the psychiatry or related to the ENT specialist. Okay, we have to put three names, and that is a medical board that will decide the which kind of, means we that patient is going for the permanent disability certification or a temporary certification. That medical board will decide. Okay, after deciding the percentage and permanent, we can go for the generation of the certificate. Okay, if prior that generation, we need to approval from the central site. Okay, means by the this UDID, we need to approve. We will get the approve within a second from the central system. Then we can go for the generation of the certificate. So after that generation, we can download and we can give the patient certificate with the stamp. Okay, and there is one certificate, and there is a UDID card, a little bit small like ATM, or nowadays that other card, digital card, not digital, just a card that will give the information of that person. That person is eligible for other schemes or the benefits, and all information regarding that disabled persons, his financial also and his scheme related also. Okay, and if suppose patient is again land up in the accident or whatever, the disability gets increased, so all information in that particular card unique. And one more important benefit of this UDID card, means the person is not carry the all the documents. Only one card he can or she can carry. So all the information you can get in the this UDID card. Okay. So after this is the what we can scattered, how we can get, or how that particular disabled person get a certificate, that is temporary or permanent. Okay,